Hello everybody, Arby here on behalf of the Medical Content Creators team, and I'm here to introduce our latest project, What's Happening with the COVID Vaccines. In this project, we will be covering the different types of vaccines available, each vaccine's recovery and effectiveness rate, the statistics in California so far, and some options for if you choose to opt out of receiving the vaccine. So our first category, what vaccines are currently available to use? So the first off, we have the Pfizer-BioNTech one. The manufacturer of this vaccine is Pfizer Incorporated and BioNTech, and this vaccine is recommended for people 16 years and over. The next vaccine is Moderna. The manufacturer of this vaccine is Moderna TX Incorporated, and this is recommended for people 18 years and over. The third one is AstraZeneca. The manufacturer of this vaccine is AstraZeneca plc, and this is recommended for people 18 years and over. And finally, Janssen. The manufacturer of this vaccine is Janssen Pharmaceuticals, and this vaccine is recommended for people 18 years and over, just like the previous two.
So different types of vaccines and their effectiveness. So many of the vaccines are listed, but the most important ones so far are the Pfizer vaccine, which is 95% effective with 2 doses, Moderna vaccine, which is 94.1% effective with 2 doses, AstraZeneca, which is from the University of Oxford, which is just being referred as to the Oxford vaccine, has 70% effectiveness with 2 doses. The Johnson & Johnson one, everyone's really excited that it's coming because we all hope it's going to be better since it's just 1 dose, but there is no effectiveness yet.
So you might be thinking, what should I expect after I get the COVID vaccine, and how should I cope with its side effects? So on your arm, which is where you would have received the shot, pain and swelling might be possible effects. All around the rest of your body, you might experience fever, chills, tiredness, and a headache. To help your arm, apply a cool, clean, wet washcloth to it and use or exercise your arm. And to reduce discomfort throughout the entire body, drink plenty of fluids and dress lightly. Just a quick reminder that these side effects are only temporary. They'll go away in a few days and you'll be back to doing your daily activities. Very briefly, I wanted to touch on the idea of herd immunity. So herd immunity occurs when enough people become immune to a disease to make it spread unlikely. While scientists don't know what percentage of the population must get vaccinated in order to stop the spread of COVID-19, herd immunity is an ideology that must be trusted until we're qualified to achieve it. I wanted to include this little definition in there, just in case, so people actually do know what herd immunity is when you hear it being talked about.
Statistics in California so far. So in California, 7,385,225 out of 7,634,975 doses have been shipped. And then 4,914,630 vaccine doses were administered February 8th, 2021, which is pretty close to our recent dates. And 66.5% of the doses were given out.
This is a map of the COVID-19 vaccinations administered per 100 people. In this map, we see that the United States is having a higher percentage, since it's in the deep blue area, on having vaccinations being administered more to the country, following with Canada and Mexico to help control the coronavirus, leading to people to decide whether to take the vaccine or follow COVID-19 procedures if waiting or still unsure yet. But is a huge improvement with all the deep blue areas of the Northern American region to have COVID vaccines administered to them and safely to the people. This is a huge improvement because in the first months of the pandemic, we didn't know what the virus was and didn't know how to control it. But now health professionals have more knowledge on COVID-19 and how to stop it. Thank you. If not wanting to take the vaccination, please follow the CDC Guidelines still for COVID-19. Stay 6 feet away from people and wear a mask at all times when at the grocery store or when walking on a trail or hike. Wash your hands thoroughly in between your fingers and in your palms. Sanitize surfaces down with sanitizing spray thoroughly every day to make sure that germs do not live on the surface of your items. Clean grocery bags with the sanitizing spray, and if you want, please use gloves to clean the bags and then throw them away so that your hands are not dirtied from the germs that were on the bags. Avoid hugging, kissing, and sneezing. These are all direct contacts that can cause COVID and make you sick. When feeling COVID-19 symptoms of fever, coughing, and shortness of breath, please stay home for 14 days. During these 14 days, please keep a mask on, sanitize all your surfaces down, and phone a doctor to make sure that is not worse. And if they need to see you, please go to the hospital and have medical assistance.
If anyone would like to know where we got our information from, these are the references that we used. And that's it. Thanks for viewing our video. As always, make sure you're subscribed in order to be notified when we upload another medical-related video. We hope you guys learned something new about the COVID vaccines, and stay safe, stay healthy. Goodbye.